is Dr. Seema Balian. I'm the Director of Ayurveda Healthcare and Chakos Learning Center. Welcome to my lecture series on NMC OSCE. Now, in this series, I will be covering up the topics related to assessment, planning, implementation, evaluation, some of the new scenarios which have been added, such as the NG tube, pressure ulcer assessment, and VIP and the intravenous flush, and also we are going to take you through the fluid balance. The aim of this series is to understand in depth that the logic behind all of the things, why we are doing, how are we doing these things, what precautions we have to take while we are doing assessment and the rest of the stations, and also the top tips. So I hope that you are going to gain out of it as much as I'm trying to put in my efforts. There are 7 episodes to this series which are going to be covering up various topics. Please do let me know if there is anything that you would like us to discuss about in future as well. And it would be great if you can subscribe on our channel and press the bell icon to get the regular updates. So I hope you will enjoy it, and thank you very much again for watching this series.
So basically what I have done is that I had shared 2 charts with you, the 2 implementation chart. One is an in-hospital implementation chart, and one is a community implementation chart. Yeah. So implementation, if you see, again, this is a station where a lot of people, they have quite a lot of apprehensions that how they are going to do and that it is going to be difficult and all that. But actually, it is not difficult at all. And you will get 15 minutes to complete the implementation, and 15 minutes is more than enough for you to go through it. The only thing that you have to remember in that is that you have to be go in a planned manner. But that is there with all of the stations. As long as you are going in a planned manner, it should not be difficult at all. And also the basic knowledge of the drugs is very, very important, which anyway, I have shared all the medications with you. So that is something which is going to be very important that you guys learn, and you are able to draw out your information from that. Because unless you know what is right, you will not be able to pick out if there is something that is not written correctly in the chart. So unless you know the correct dose of a medication, you will not know that whatever dose is written over there is whether it is correct or it is not correct. Same is with the frequency and the route, that unless you know that this is something that can be given orally, or that is given IM or intravenous or something, unless you know all these things, you will not be able to figure out if the chart is written wrongly, and you might end up giving the wrong medication. Yeah. So that is the reason it is very important that you must know what is the R's of all of the medication, at least the most common ones. For the others, once you are in the hospital or once you are in your workplace, there will be lots and lots of other medication which you are going to learn as you go along. So there will be so many things that you will need to look up in the BNF every day, and your drug knowledge is going to get more and more and more the more you are going to be looking into them. Yeah. So my plan today is that we are going to go through the drug chart, both of the drug charts. So, and I'll tell you that how, when I say that we have to go in a planned manner, that what exactly do I mean by that? That how to read a drug chart, what are the things that we will, which are important, what we should do, what we should say. Those are all of the things that I would like to go through with you guys. And also, I will be able to show you how the medication looks like, how the drug trolley look like, and how the setup is going to be in the exam. Okay. So let me just bring up the drug chart. So we will go through the hospital drug chart first. Okay, can you see my screen?
Yes, ma'am.
Okay, so your friend Raj Palmer. Yeah. So just you are going to get a scenario, like for every other station, you are going to get a scenario for the implementation as well. So you know that we did the assessment of Raj. So if we take it like a continuation, so in the assessment, we found out that, okay, Raj is due for a carpal tunnel surgery. Then for care plan, we got the care plan that, okay, he has had a surgery and now he is post-operative. So this is like, we can take it in continuation that now he is post-op, having returned to the ward at 14:30 hours, and he has slowly been increasing from sips of water, and he has just taken a cup of tea. Currently it is so you will require to give the medication of 1800 hours, and they have said that assume it is today and it is 1805 hours. Okay, so in your implementation, they will give you the what time medication you have to give, and they will also tell you that what is the time at the moment. Okay, so sometime it can be like 5, 10, 15 minutes here or there, depending upon the time, because as you know that in the real practice as well, it is never possible that you will give everyone at exactly the same time. So you might give, maybe the first patient that you are giving, you might give at 1800, but by the time you finish your first patient, the next one that you go, it is going to be like 1815 or something like that. Yeah. So normally how it is that the drug rounds usually will start around 15 minutes before it is the due time, and will carry on for about 15-20 minutes after that, depending upon how many people you have to give the medication at that time. Okay, so don't feel that if you have given, if the time is not 1800 hours, then it is something wrong over there. So it is absolutely fine. Fine. So this is, everyone has read this. So if you will see that there is a name, date of birth, and the patient's hospital number is given over there. Yeah, in the, and they have given some advice that you have to talk to your patient. So in this scenario as well, it is going to be a mannequin. There is not going to be a real patient. But when you are having the mannequins, we have to treat all of the mannequins just like the real patients. So we will be looking at the mannequins, and you will be required to talk to the mannequin as if it was a real patient. Yeah. So you will need to verbalize everything that you are doing. So whatever, when you are checking the medication, like all the other station, whatever is in your head, the examiner, they can't read it. So you will need to verbalize that one. Then you will need to read the chart aloud and explain what you are checking, giving, not giving, and the reasons that why you are giving a medication, why you're not giving the medication. You will need to complete all the required drug administration checks, complete the documentation with and use the correct codes. The correct codes are on the prescription chart and on the drug trolley. Check and complete the last page of the chart. Ensure to complete all section of the documentation, and that you are going to get 15 minutes to complete it. Okay. So now let us come to the first, the beginning of the chart, that how does a first page of the chart looks like. So this is the first page of the chart. So when you open, this is how the chart is going to look like. So if you look at it, at the top, it is going to give the patient's name, patient's gender, hospital number, date of birth, address, and then it is going to tell the admission date and time. And it is also going to tell about the whether the patient is allergic to anything. And there is going to be the signature of the doctor, and the date is there. After that, on the first page itself, you are going to, there are
Ma'am,
some
your voice
instructions.
is cracked.
Sorry. Was someone saying anything? Agu, were you asking something? Okay, doesn't matter. We'll continue. Okay, so you can see on the left-hand side, there is some information to the prescriber. And on the right-hand side, there is information for nurses administering medication. Now, this is an important sort of area where you will have to look that, let me just increase the size of this one. Let me just increase the size for this one. Then you will be able to see it in a better way. Can you see it better now? Yeah.
Yes, ma'am.
Yeah. So if you see this section, where it is the information for the nurses administering medication. So that is the section where you can see that there are around 9 codes which are written. Yeah. Now, these are the codes that we were talking about. So sometimes what happens is that when you are administering the medication, you are not able to give some medication because of certain reasons. Yeah. Now, these are all of the reasons which are there. So maybe one of the things can be that when you go to the ward, patient is not there. So that is the reason that you cannot give the medication to the patient. So you will need to write the code over there, because see, the medication was due at 1800 hours. And if you are not able to give it at 1800 hours, we need to know that why you were not able to give it at 1800 hours. So in order to tell that why you were not able to do that, you will need to put a code. So you will put a code 1 over there if the patient is not on the ward. Yeah. Or if it is that, say, for example, if the patient is written for some amoxicillin and this patient is allergic to penicillin. So you are not able to give this medication because patient is allergic to penicillin. So that means that you cannot give this, because if you give it, patient is going to have an allergic reaction, and that is going to be clinically not good for the patient. So you are going to put a code 2 over there, because you are omitting this drug for clinical reason, because patient is allergic. Same will happen that maybe if it is that you are going to give paracetamol to a patient, but you realize that the patient was given paracetamol only 2 hours ago. So you can't give the paracetamol to the patient at the moment. And that, because if you give it, it will become like an overdose. An overdose is again a clinical condition. So you will not be giving this paracetamol because of the clinical reason. So you will have to write over there that it was omitted for a clinical reason. Then sometime it is possible that the medicine is not available in your trolley, or it is not available in the pharmacy, and that is why you can't give that medication which is not available. Sometime patient might refuse. They might say that I'm not going to take the medicine. So you can't force the patient. So if the patient has refused, you have to tell that patient refused to take the medicine. Sometime it is that patient is suffering with such a severe nausea and vomiting that you cannot give the oral medication to the patient, because patient is having severe nausea and vomiting. Then sometime it is also possible that it is illegible, that you can't read the medication, what is written. It is incomplete, that the doctor's signature is not there, or the dose frequency is not written, or they have not given the correct doses of the medication. Yeah. So it is incomplete, or it is wrongly prescribed. By wrongly prescribed, it means that it is possible that they have written the wrong dose or the wrong frequency, or it is something, the name of the medication is wrong. So there might be other things which they have put as a wrong medication. The route might be wrong. So if it is something that they are putting illegible or incomplete or wrong prescription, then also you cannot give that medication. So you will have to put a code of 6 over there. Then if the patient is nil by mouth, so you can't give oral medication if the patient is nil by mouth. If it is a IV medication that you have to give, but there is no IV line, then you can't give the IV medication. And then there might be some other reasons which are not documented over here. So if you feel that there is any other reason, so then you can write the code and you can mention what is the other reason. Okay. Have all of you understood this one?
Yes, ma'am.
Ma'am, for 1 second.
Yeah.
Actually, if a patient is allergic to penicillin and the doctor has prescribed for penicillin, it will become under wrongly prescribed medication or omitted for clinical reason.
See, I would go more for omitted for clinical reason, because although it is wrongly prescribed as well, because they should not have prescribed penicillin if a patient is allergic to penicillin. But over here, how we are looking at it is that if the medication itself is not wrong, it is the right medication which is written, the dose and the frequency and everything is written correctly, but you can't give it to the patient, because if you give it, patient will get an allergic reaction, which is a clinical condition. So that is why we go more for that it is a clinical reason that you are not giving the medication, not that it is wrongly written over there. Yeah, does that make sense? Any other questions so far?
Yes, ma'am.
Okay, Agu, go ahead.
From the charts you gave us, you wrote a doctor's name and the bleep number, but there is no signature. On exam day, will there be signature, the signed one, and the name and bleep number?
So the signature actually, obviously, because it is not something actually someone is going to sign. So in the exam as well, if it is written over there, even if the doctor's name is written, that is considered as signature of the doctor, and the bleep number is written.
Okay, ma'am.
Yeah. So now after this section, if you look down, then it says that if so it says on over here that if medication are not administered, please document on the last page of the drug chart. So these ones, so if at any point, if you decide that you are not going to give any medication to the patient for any of these reasons that we have just discussed, and you will require to put a code over there. So as soon as you write the code over there, at the same time, you must fill in the section, this section over here as well. On your left hand side, if you see drugs not administered. So over here, you will have to write a little bit more of a detail, because in against the medication, you can only write the code. There is not much space over there for you to write, explain your reason. So you are going to write a code over there, but the explanation you are going to do it over here in the end, that the drug was not administered, date, time, which drug was not administered, the reason for that, and the name and signature. So this must be completed at the same time as you are writing the code over there, because if you leave it, then it is highly possible that you will forget writing it. And if you forget it, then you will not be able to pass this station. Yeah. So coming back to the first page. So then if you see, as we go along, you will see that it is it is written as that which ward the patient is. They have given the information about the ward, who is the consultant. Then there is the information about height and weight of the patient as well, and if there are any special dietary requirement. Now, why does height and weight, why is it so important? Titi, can you tell me that why is height and weight important? What is the significance?
Ma'am, we
can
need to
say-
calculate the dose according to the patient weight and height.
Absolutely. So all of the medication, if you will see, and if anyone has worked in pediatrics, you will know that all of the doses, they are calculated according to the weight of the patient. Yeah. So at some point, obviously we have to decide that now the patient's weight is that much that they can just be considered as adults and they should be given the adult doses, because in adults you do not keep on calculating it according to the weight. Yeah, you come to a certain sort of cutoff that, okay, above this weight they are eligible to take just the adult doses. Yeah, so that is why more than height, weight is very, very important, because the medication are calculated according to the weight. So can you tell me that what is the cutoff kind of a weight that we would say that, okay, above that weight we will consider people as the adult weight and they can have adult doses?
Oh, 50.
From 50 kg.
Yeah, generally we take 50 kg as that one. And if the patient's weight is more than 50 kg, we would consider that, okay, this is kind of an adult weight and that the patient should be able to take the adult medication, the adult doses. Okay, so it is very important that you check the weight and you establish that the patient weight is more than 50 kgs. So they should be able to take the adult doses safely. It is more important when patient is having paracetamol, because paracetamol is very, very important that you give paracetamol 1 gram only if the patient is more than 50 kgs of weight. So sometime in some of the scenarios, it is possible that your patient might be a frail old lady of say 47, 48 kgs. Yeah, and she's written for 1 gram of paracetamol. But you can't give 1 gram of paracetamol to her because her weight is less. And for her, 1 gram is like an overdose, because for her weight, that becomes more than what she requires. Okay. So you cannot give her the full 1 gram of the paracetamol. Fine. So far, so good. Everyone understood page 1?
Yes, ma'am.
Okay. So now we are going to come to page 2. So can all of you see the page 2? I'll have to minimize it a little bit. Okay. Yeah. It's not working, is it? Okay. Anyway, can you see it now? Okay, this is the page that we are talking about, the page number 2. Fine. So in the second page, if you will see, so on top of every page, you will see that it is the patient's detail are written on top of every page. So it is very important that you check on top of every page that the patient's details are correct, because sometime it is possible that because these are loose sheets which are stapled, it is possible that it might be by mistake someone else's sheet is stapled over here. So for that reason, it is very important that you establish that this drug chart is complete and it is of the same patient. So all the details are correct for that one. Yeah, and on top of every page they will clearly ask that if the patient is having any documented allergies as well. So you need to be very, very careful with allergies as well. So it is very easy that once you have gone through the first page and you start going through the medication, the other medication, it is very easy that you forget that patient was allergic to something and you end up giving that medication, because at the moment, at that time, you are more concentrating on that particular medicine. Yeah, for example, like if patient is saying that they are allergic to paracetamol, and you acknowledge it, But when you are going through your chart, you reach the regular medication section and patient is like saying that, oh, I'm in so much pain, I'm in so much pain. And you completely forget that patient is allergic to penicillin and you want to deal with the pain that the patient is in, and you end up giving the paracetamol, which is obviously wrong. So it is very important that you make sure that you remember the allergies, and before you give any medication, that you always check that patient is not allergic to that particular thing. Okay. So then we come to this in the second section, second page. The first section that you get is once only and the stat medication. So everyone understand the meaning of stat medication?
Yes, ma'am.
Yeah, so these are the medications which you give once only at that particular time to deal with certain things which are required only at that time. And these are not the medication which will be essentially repeated on a regular basis. So it is only to be given at that time. So if you see in the stat medication, patient is written for lorazepam.
Hello, honey.
So if I'm going to be reading this chart, yeah, I will be reading this chart in a way that I'll say that, okay, Raj, I can see that your next medication or the first medication lot is the once and the stat medication. So I can see that you were given lorazepam in the morning today. So it was a stat medication which was given. You were given a dose of 0.5 milligram in the intramuscular route. And I can see that the doctor's signature and the bleep number is there. And also the nurse who gave it, her signature is also there, and it was given to you at 8:40 in the morning. Yeah. So then you can say that, okay, lorazepam is basically an anxiolytic. So it helps you reduce your anxiety. So probably it was given to you before you went for your surgery because you were quite anxious. Remember that now it is 1800 hours and this medication was given at 8:40. So it is after that patient has undergone the surgery and all that sort of thing. So it is very likely that it was given before the surgery to the patient. Yeah, because patient was very anxious. So now when we are reading the chart, rather than reading it that, okay, today start date, the time due is stat, lorazepam 0.5 milligram, route is IM, signature is there, prescriber's bleep number is there, given by is there. So it might be better way of reading that, although you are reading all of the things, but you are reading that, okay, I can see that you were given lorazepam for your anxiety. Today morning, it was given as a stat medication. The dose was 0.5 milligram and it was given through intramuscular route. And I can see that the doctor's signature and bleep number is there. And it was given at 8:40 in the morning. And the person who gave their signature is also there. Yeah, so you can read in this way so that it looks natural, but you are still able to see all of the things. So what are all of the things that you need to make sure when you are reading the chart? What are the things that you need to check? Can anyone tell me? Jinsi, can you tell me that what are the things that you will be checking when you are reading the drug chart, which are essential to say that, yes, this drug chart is correct and the medication that written is correct?
Right patient, the rights of the drug.
So there are 5 R's that we are
Right patient.
Right patient, yeah.
Yes, right patient, right drug,
Right medication,
dose,
yeah. Dose,
right dose, right route,
yeah,
right time,
yeah,
and right documentation.
And right documentation. Yes, absolutely correct. And well done for that. So this is for your implementation. You can almost say the 5R is like a mantra that you have to know and you have to say for every medication. Yeah. So along with the 5 R's, once you have done that, you have to also say that this prescription is legible and it is a valid prescription. So that is going to complete your reading of the medication. that I can see that I know that you are my correct patient because you have checked the patient 3-way ID check, remember? And that I can see that it is the correct medication. There is a start date to it. It is a correct dose. There is correct route and correct documentation are there, that the doctor's signature and bleep number is there. I can read this medication and it is a valid prescription. So it is a safe either to give or it was safe to be administered at that time. Okay, so, and this is something that you will actually have to verbalize. All of the R's you will need to verbalize with the patient. Yeah, that because the examiner needs to know that whether you know all the R's of the medication. Okay, so then comes the next section. So sometime in the stat medication, sometime it is possible that they have written a medication, but it is not given. Yeah. So if there is any medication which is written in stat, but has not been given, then you will need to give that medication. Yeah, because it is a stat medication which should be given. So you will be checking all the R's and making sure that it is a valid prescription. And after that, you will be giving that medication. Have everyone understood that? Yeah. Okay. So then we go to the next section. So if you see the next section, it is prescribed oxygen therapy. So if sometime it is possible that the patient is prescribed some oxygen, so it will be written as a prescription. So like in this one, if we see that the patient was started on oxygen today at 8 o'clock, the prescriber signature and bleep number is written. Then they have given a target oxygen saturation. That the target is that the patient's oxygen saturation should be more than 96%. Then it is also written that the therapy instruction that post-operative recovery until fully awake. So it has to be continued till the patient is fully awake. And also once we have achieved the target of more than 96%. It is given via a nasal cannula. The flow rate is 2 liters. And you can see that the time it was started was 11:30 in the morning. Yeah, the nurse's signature is also over there. So when you come to this section, you will need to ascertain two things over here. One, that the patient is fully awake. And the second thing is that the saturation of the patient is more than 96%. Okay. So you already have got the history that the patient is now up and he has had a cup of tea and all that. So we will take it that the patient is now fully awake, that he is able to drink and he is had something to eat. So it is the patient is fully awake. And the oxygen saturations, you will ask the examiner that examiner, can you tell me what is the oxygen saturation of my patient? So the examiner will say that, okay, the oxygen saturation is 97%. So you can say that, okay, I have reached, it is more than my target saturation and patient is also fully awake. So I'm going to be removing the nasal cannula and stopping the oxygen. Yeah. So once when you are going to be stopping it, you will do your hand hygiene because you will be touching the patient in a way. So you'll do your hand hygiene, take the nasal cannula off from the patient, keep it aside and do your hand hygiene again. And you are going to document at the same time that you have removed the nasal cannula and you have stopped the oxygen. Okay. Do not wait that you are going to sign everything in the end. Do not wait. Okay. So if you have stopped the medication now, you are going to sign it at the same time. Okay. So once you have signed it, you can reassure the patient that, okay, I'll come back again in about half an hour to check your oxygen saturations again and to make sure that you are maintaining them without oxygen. Yeah. But if you feel that you are getting any shortness of breath or any problem, do let us know. Okay. So always do your safety netting as well. So then we come to the third section, which is a PRN medication. Now, does everyone?
One
Sorry.
second, ma'am.
Yeah.
Regarding the oxygen saturation discontinued time, whether we need to ask the assessor that what is the time we need to document?
Assessor have already told you that it is 1805.
1805. So we will document
Yeah.
in 1805 only.
1805, because that is the time that you are giving all these medication or checking the drug chart. Yeah. Okay, so next section is the PRN section. Now, does everyone know what is a PRN medication? Anju, can you tell me what are the PRN medication?
Whenever necessary, ma'am.
Yes, absolutely. So PRN medication are as needed medication. And as it suggests that you are only going to give these medication if they are required. If they are not required, you will not give the medicines. Now, sometimes it happens that, and I'm sure that you would have been in that situation, that you go to the doctors for certain things, and the doctor will say that, okay, I'm writing you for some paracetamol as well. Take it only if you have pain. Otherwise, you don't need to. Yeah. So those are like the kind of PRN medication. We need to write some medication as PRN because we never know that whether the patient will be in pain. Sometimes patient can be very sick or feel nauseous or something. So we can write them that in case if these things happen, then the nurse does not have to go and search for the doctor or to get it written. It has been written in the PRN medication. So it can be given if it is required. Okay. So in this one, again, we are going to, like, if we have to read this chart, we are going to read in the same way that I can see that you were given, so that you are written up for some morphine sulfate, which is a painkiller. And you were given 10 milligram through intramuscular route in the morning at around 11:30. So we know that it is a pain medicine that was given. So once you know that the pain killer was given, you can always ask the patient that, so how is your pain? Is it any better now? Yeah, if the patient says that, yes, my pain is better, then the next question will come that, okay, can you rate your pain score? Whenever you are talking about pain, please make sure that you are always going to ask the pain score on the pain scale. So you are going to ask the patient that, can you tell me that what is your pain score? Like if 0 is no pain and 10 is the worst pain, where are you going to rate your pain? Yeah. So if the patient says that, okay, I have got a pain score of 2. So then you know that yes, patient is actually comfortable because pain score of 2 is very less. Sometime it is possible that the patient may say that, okay, my pain score is 4. Yeah, then you can say that, okay, you are still in a moderate amount of pain. Is it any better than what it was before? So patient will say that, oh yes, earlier it was 8, now it has come down to 4. So then you know that it is getting better. You can also check with the patient that, do you think that you are managing all right, or would you want any more painkillers? Yeah, patient might say that, no, actually I'm managing pretty okay with the pain. I do not want any painkillers. Or it is possible that patient will say that, yeah, I think that I can have some painkillers. Then in that case, if the patient says that, yes, I can do with some more, then what you can do is that now you can see that in your PRN medication, they are not written for any further painkillers. So you can tell the patient that, okay, let me go through the chart. It is possible that you are written for some pain medication on the regular side. Yeah. And if you are written for some painkiller and if it is due, then I will be able to give you the pain medication. Okay. Then if you see, the next medication is cyclizine. So again, you are going to read the same way that, okay, the next medication, I see that you were given some cyclizine as well. That is an antiemetic, or it is an anti-sickness tablet, a medication. And you were given an injection at 11:30 at the same time when you got the morphine. So how are you still feeling sick? So again, the same question, that you have given some medication. So you are now going to ask what effect that medication has had and whether the patient is feeling any better. Okay, has everyone understood that one? Yeah. Now sometime it is possible
Yes, ma'am.
that you are written, like say maybe in this one, for example, the third medication was written as paracetamol. Okay, so you will see that, okay, it is written paracetamol, 1 gram per oral route, 4 to 6 hourly, and the doctor's signature and bleep number is there. Okay, but it has not been given. Now your patient has just told you that patient is in pain, so his pain score is 4. So what will you do? Who is going to tell me? Lakshmi, do you want to tell me that what are you going to do if this is the case?
Yes, ma'am, I think I should give it.
You think that you should give it? How many people agree that you should give it?
Yes, ma'am, I see he is having.
Okay. Will you give it straight away? Will you decide it
I see
at this
it.
time?
Hello, ma'am.
Yes, yes, Lakshmi, go ahead.
Hello.
Yeah, Lakshmi, I can hear you. Please go
Yeah, ma'am,
ahead.
as he is having. As he is having experiencing pain, I'll ask him to scale his pain.
Mm-hmm.
You still have pain, so I think I should give it. If it,
Okay. So, but okay, you decide that you are going to give this medicine and you give this medicine to the patient, and then you move on in your chart and you find that in the regular medication, patient was actually written for some codeine phosphate, which was due at this time, or he was written for some paracetamol time. But you have already given the patient paracetamol from the PRN.
hello, ma'am, I can't hear.
Hello?
Can't hear properly, ma'am. Sometimes the voice is breaking, so it's not that clear.
Okay. And Roshni, can you hear me? Do you understand that what I'm trying to say?
Yes, ma'am, I can hear you.
So what do you think about this scenario or this situation, that you decide that you are going to give the medication paracetamol in while you are in the PRN? You give the medication and you move ahead, and then you find out that in the regular medication patient was written for some paracetamol and it was due now at 1800
Uh,
hours.
in
So what are you going to do then?
in PRN medications, if it's already if we given, then we are not gonna give again. But it is mentioned regular medications at the 18 hours, so I can give that medication now, unless
So but if you have already given it in the PRN, how are you going to do?
if they are already given in the PRN, then I'm not gonna give here in regular medication, and I mentioned that it's already given.
So do you think that that is the correct way of doing it?
No,
What is the correct way?
we have to check the regular medication list first. Then only we have to move to the PRN medications, because PRN is
Absolutely.
as needed.
Absolutely. So we should not jump when we are on the PRN section. We should not make the decision that I'm going to give the medication and give the medication at that time, because it is possible that the patient is written for some regular painkillers or regular medication. So PRN is only as a backup medication which are written. You should always give the regular medication first. And if there is anything like, say, for example, patient is written for regular medication of codeine phosphate. Yeah. But codeine phosphate patient has taken, you have given as a regular, and the patient gets pain again after 2 to 3 hours. Now he can't take codeine phosphate again, but he is in pain. So then at least you know that in the PRN medication, there is paracetamol which is there, which you can give. But if you give medicine from PRN, you can't give the regular medication at some other time. Yeah. So it is always that the regular medication are always going to be the first one that you are going to check. PRN, you are only going to give if the patient is not written for any painkillers on the regular side. Then you can come back if patient is not written for any painkillers, but still complaining of pain. Once you have gone through all of your chart, you can then come back to the patient saying that, okay, I know that you are not written for any other painkillers and you are in pain. So I am now going to give you the PRN paracetamol. Has everyone understood that?
Yes. Yes, ma'am.
Yeah. So whenever we are reading, whenever we are giving or deciding the medication, the regular medication should always be checked before you decide to give any PRN medication. Okay. So we can just make a note that yes, patient is having pain, and yes, that he is written for some PRN painkillers, but let me just check what is there on the regular side. And if there isn't anything on the regular side, I'll come back to these ones. Okay. So that brings us to the next section, which is the section of the antimicrobials. So we are again going to check the patient's details, that all of them, they are correct. And we are again going to check that patient is not allergic to anything. And then we are going to start reading our first medication on the antimicrobial side. Now, this is the format which you have got now. This is the format which normally is going to be there for all of the medication, where you will need to check all the R's over here. Yeah, so you can see that the first medication is the probiotic drink. Now, does everyone know what is a probiotic drink?
Yeah.
Who said
Actually,
yeah?
Bonnie.
Bonnie?
Yeah.
Yeah. So Bonnie, would you like to just explain it to everyone that what is a probiotic drink?
It's a yogurt drink. It can come with a flavored or in original flavor that has some bacteria. But it's like
So why do we give the probiotic drink?
for the when we give the antibiotic, we give them for the proper digestion,
Okay.
protect the stomach.
Okay, that's great. So basically, I don't know that how many of you have you heard about Yakult? Anyone heard about Yakult? Okay. So I'm sure
ma'am.
that okay, that's good. I'm sure that I think that you will agree with me that when we were kids, and even now, like if you get ill, and there are certain things which like if you are having a lot of medication and thing, that usually our parents or someone or grandmother, she will say that, oh, have some yogurt. If your stomach is not feeling well, try some yogurt, that is going to help you. Yeah, everyone would have heard that thing, and everyone would have tried it. Now, why do we eat yogurt? What does it do?
It helps to reduces the diarrhea associated with the antibiotics
Yes.
or
So
colon stomach.
what does yogurt have in it? I'm sure that you must have done that experiment that yogurt has something that you
It's
are.
improved the intestinal flora.
Yeah, but what
It
exactly
improves the
improves that?
intestinal flora.
Lactobacillus bacteria.
Absolutely. So
Lactobacillus
it has the lactobacillus bacteria.
bacteria.
Yeah. So it is like a rod shaped bacteria, which is a good bacteria. So when we say that it helps to improve the flora of your gut, when we say flora, what we actually mean is that the flora is basically the good bacteria that we have. Because in order for us to digest the food and thing, we need bacteria. And that is a good bacteria. So it does not make us ill. It actually helps in digestion. But when you are taking antibiotics, because they are antibacterial, they do not know that which bacteria to kill. Yeah, so they will have an effect on your good bacteria as well. So even the good bacteria gets depleted when you are taking antibiotics, and that is the reason that with the antibiotics you have this nausea, vomiting, diarrhea, all those things, because now your food is not being digested because there is not enough good bacteria which is there. So in order to replenish all that good bacteria and help you not have the tummy upset, that is where you give the probiotic drink. And as the name suggests, it is probiotic. So it is a good bacteria that you are giving. Yeah. So these are like yogurt drinks, and they come in a small drink, sort of a small bottle, which is like a one shot drink that you have. Yeah, just hold on a minute. I'll show you that how it looks like. So this is basically how it looks like. Yeah. It comes in lots of different names. So it is Actimel is quite a common name. Yakult is very common name. So these are the few of the common sort of thing. And as you can see that they can come in a natural flavor or a strawberry flavor or raspberry flavor. So there are lots of flavors as well that it comes. And it does not have that, okay, as you will see in the prescription, it says that under the dose, it says 1. Yeah.
One bottle.
So it means that it is 1 bottle that you are going to give. Okay. So there won't be any mils or something written on it. It will just say 1, so that you are going to give only 1 bottle. Frequency is usually twice a day, and oral route duration is written. So when we are going to read this chart, yeah, you are going to say that, okay, I can see that the next medication which is written is probiotic drink. This is a drink that you take to help with your gut, and it is going to improve your gut flora and hence reduce your side effects from the antibiotic which you are written for. Now I can see that it is to be given today. Dose is 1. It is frequency is twice a day with oral route, and it is to be given for 7 days. And I can see that there is start date and finish date, and the doctor's signature is written. So, and the frequency times are written as 8 o'clock in the morning and 1800 hours in the evening. So I can say that this is all the hours are correct, and it is legible, and it is a valid prescription. So I can see that it is due at the moment, because remember, you are giving the medication for 1800 hours. So it is due at the moment. So I will be giving you this medication. Okay. Now you have decided that you are going to give this medication. You don't need to give it at the same time. What you will do is that you are going to just put a dot over there, and you are going to open your drug trolley. Yeah, and you are going to tell the patient that, okay, you are going to take out the Actimel or the probiotic drink from your drug trolley, and you are going to check that, okay, this is the same medication that is written in your notes, and it is within expiry, so it is safe for me to give, so I will keep it outside to give this medication. Everyone understood the sequence? Okay, so I'm just going to take you near the drug trolley to show you that how actually it is going to look like. So can all of you see the drug trolley? Yeah. Can you see the drug trolley?
Yes.
Yeah.
Yes, ma'am.
So what I'm going to do is that I will be saying, can you hear me?
Yes.
Yes, ma'am.
So I'm going to, once I have decided, so I'm going to put these ones back. Once I have decided that yes, I will be giving you this medication. So what I'll do is that I'm going to put a dot over there that I will give this medication. I'm going to wash my hands, yeah, do my hand hygiene and say that, okay, now I'm going to unlock and open my drug trolley and I'm going to open it. I'll take out Actimel, which is the probiotic drink, and I'm going to read it that, okay, I can see that this is the correct medication and it is within expiry. So I will leave it outside to give it. So you are going to leave it outside so that you can give it to the patient. Okay. So then I move on to the next medication. Now my next medication is co-amoxiclav. So co-amoxiclav, what is co-amoxiclav? Can anyone tell me?
It's an antibiotic.
It is an antibiotic, but what does it contain?
Amoxicillin. And
Amoxicillin plus flavoxycillin.
So it is a combination. It has it is, as the name suggests, it is amoxicillin and it is cavulonic acid. Now, what is the normal dose for amoxicillin? Oh, sorry, the co-amoxiclav. Now, look at the prescription. So, Bonnie, can you look at this prescription and read it out for me? And tell me whether it is something that you can give or whether you can't give.
it's written in 625. No, we can't give.
Read it how you will be reading.
It's a comoxiclav and it should be given today. The dose is 625, but not given like a in milligram or microgram, not given. Frequency is given, that's good. QDS, that means 3 times a day. Per
QDS?
oral. Yeah.
What does QDS mean?
3 times a day.
What does QDS mean? Anyone else?
4 times a day.
Yeah. TDS is
Oh,
3.
sorry. Yeah. 4 times a day per oral for 5 days. The
Mhm.
timings are like 6 o'clock, 12 o'clock, 1800 and 22 hours. But the dose is not in a correct prescription.
Is the frequency correct? What is the frequency of co-amoxiclav? Angel, can you tell me? What is the frequency?
It should be 8, 12, isn't it? Yeah, it should be 8, 12, 18, 22.
The frequency of co-amoxiclav is thrice a day, 3 times a day.
Oh, okay.
So over here, even the frequency is wrong. So guys, you need to start reading the medication. You should have known this answer. Yeah. So even the frequency is wrong. And as you have said, Bonnie, that they have not mentioned the units of the medication. So you cannot prescribe this or you cannot give this medication. So this medication is
not a legal prescription. Illegal
invalid prescription. So
Invalid
it is an invalid prescription. So what are you going to do now?
Ask the doctor to rewrite it.
Okay, before that, what you are going to do? What are you going to document in the notes on the drug chart?
On the drug chart, the code.
Yes. So which code are you going to give?
Which
code are you going to give? So if I bring up the codes, here are the codes.
Okay, thank you. 6, incomplete or wrongly prescribed medication. Illegal or
so
incomplete.
you are going to write the code over here.
Yeah, then we need to write at the end.
And you are going to, at the same time, you are going to write at the end as well that the prescription is invalid and that you cannot give the prescription because it was written wrongly or the units were missing and the frequency is incorrect. Everyone understood this one?
Yes.
Yeah? Yes. Okay. So now we move on to the next medication. So I want you, one of you guys, to read me the next medication. So Vrinda, can you read me the next medication? So you have now come into the regular side. So read that medication for me. Can you hear me, Vrinda?
Yes, ma'am. It is paracetamol.
Okay.
Paracetamol. The state is it is need to given today, and
Uh-huh.
dose is 1 gram. Frequency 2 days. It means 4 times a day,
Yeah.
and the route is per hourly,
Uh-huh.
and duration is 7 days.
Uh-huh.
Um,
What else are you
and the
going to check?
time need to given is the time need to given is 8 a.m. 12 in afternoon, 12 in noon, and 18 hours and in 22 hours.
Okay. So what are you going to do? What is the time now?
Now it is 18 hours.
So you can see that medication is due at 1800 hours.
Yes. I need to give that medicine in this time.
So what are you going to say? Huh? What? So you are going, yeah?
Okay, I will tell to the patient that I will give this medication now.
So you are going to say that, okay, Raj, this is the medicine, paracetamol is a medicine given for pain. So as I had already checked that your pain score was 4 and you are in pain, so I can give you this medication. I have checked all my R's and it is a valid prescription. So I will be giving you this medicine. Yeah, and you are going to put a dot in front of the 1800 and you are going to look for the medication over here. So in your drug trolley, you are going to look for some paracetamol. So I'm going to take out paracetamol from my drug trolley. So that is a paracetamol. Yeah, and I'm going to be checking for its expiry and I'll say that, okay, it is within expiry. So, and you require, so I can see that you will require 2 tablets to make 1 gram of the dose. Now, before you give the paracetamol, what are the other 2 things that you are going to check?
Allergy. Is there any?
So that makes it 3 things. So allergy is one thing. What are the other 2 things?
Expiry date of the medication.
So that is for every medicine you are going to do for that month. See, this is the single most important question that is there for your exam.
If you had any paracetamol in PRN side recently?
Absolutely vital that you check that the patient has not had paracetamol in the last 4 hours.
Yeah.
It is the most important thing that you can do, because see, if people fail this implementation, out of 10 people failing implementation, 9 will fail on this reason itself, that they did not check that whether the patient has had paracetamol in the last 4 hours and they gave paracetamol when 4 hours were not up. So it is very important that you check that the patient has not had paracetamol in the last 4 hours. What is the other thing that we had discussed earlier? What is the other thing that you are going to check? You will be checking the weight of the patient. Remember, you can't give 1 gram of paracetamol unless the weight of the patient is more than 50. Okay. So it is very, very, very important, and I can't stress it enough that for paracetamol, you have to make sure that you check all these 3 things: that patient is not allergic to paracetamol, patient has not taken it in any form. It is either stat, PRN or IV or oral, in any form. Patient has not taken it in the last 4 hours, and that the patient's weight is more than 50 kg. So You have checked these things. So I can say that, okay, I know that my patient has not taken paracetamol in the last 4 hours. And also the patient's weight is more than 50 kgs. So I can safely administer paracetamol. So, and it is within expiry. I can see that it is 500 milligrams and I need to give 1 gram to the patient. So I will be taking out 2 tablets from over here. So you are going to take a small dispensing pot and you are going to be taking 2 tablets out of over here, and you will keep this medicine near to your dispensing pot so that you know that these are my paracetamol medication. Okay. Now I'm ready with, so till now I can say that I'm going to be giving the probiotic drink and I'm going to be giving the paracetamol. Coamoxiclov, I have already signed that I'm not going to give that. Now let us move on to the next one. So Titi, you read me the next one.
Okay, ma'am. The name of drug is codeine phosphate, and the date is today, and the dose is 30 mg, and the frequency is QDS. It means 4 times per day, and route is orally, and duration is 7 days. And here is time is written 8 hours, 12, 18, and 22 hours. So, and the prescriber signature and signature also is written. So the start date is today, as I already mentioned, and the finish date is like plus 7 days. Okay, for that, yeah, it's due. It's due for 8 hours is due. So I need to 18 hours is due. Okay. So I need to know that the patient is allergic to codeine phosphate. So do you have any allergy?
No.
Okay. Then I need to check that you had taken this tablet earlier. So for that, I need to check the PRN.
Okay.
Okay. Okay. So do you have pain now?
Yes, I do have pain.
Okay, if you don't mind, could you please rate your pain by a pain scale? 0 means no pain, and 10 is the severe pain.
It is 4.
Okay, it's 4. Okay, that's fine. Okay, so did you want to take the painkillers, or you can tolerate by yourself?
Yes, it is. I would like to.
Okay. But from the regular medication, I had taken the paracetamol. So, so you have already paracetamol. So it's, I think it's not necessary to take the both painkillers together. So because you already had taken. So
Oh, but the doctor
that I
said
will
I
mention.
need to take both of them.
Yeah, I know that. But you know, if you are taking the both painkillers, it means double dose. So you will get some kind of side effects. So I just want to prevent that. Okay, so I will definitely inform to your doctor, and I will make clear in the why I'm not giving this medication. Is that fine?
Okay. Okay, now you mentioned that it is going to be a double dose and that's why you're not giving the medication. Why do you think it is a double dose? You're not giving the same medicine.
Yeah, because we are giving the paracetamol, no? So that's why it's a pain medication.
See, I understand what you are saying, but sometimes it is quite possible that on the regular side you might find 2 painkillers which are written. You might also find 2 antihypertensives which are written, because or 2 anti-diabetic medications which are written, because it is possible that the doctor thinks that one is not enough and that is why you require 2 of those things. And these are, remember, these are the regular medications, so patient probably is anyway taking them. So how often you would have seen that one patient, one antihypertensive is not working and that is why another antihypertensive is added.
Okay.
Yeah.
For that, we need to give both medications if it's written in regular medications.
If it is written in the regular side, then and if they are different medication, because see, paracetamol works in a different way and codeine phosphate works in a different way. Although both of them they are helping the pain, but they are not the same medicine. So it can't be an overdose of that medication.
Okay, ma'am. If the patient is mentioned that their pain is like normal, they don't have any pain means, then also we need to provide that.
We are going to suggest that they should take it, because it is, see, it is possible that because they are taking that painkillers, that is the reason that their pain is under control.
Okay.
Yeah, but if the patient is still adamant that no, I don't want to, then that is fine. Then you can put that code that patient refused. But you are still going to suggest that because it is a regular medication, that they should be taking the regular medication. You can say that, okay, if your pain is not like if your pain is not bad, then what we can do is I can discuss with the doctor to see if they can take it off from the regular side and maybe put it on the PRN side. But at the moment, because it is written, I have to give it.
Okay.
Yeah. So on the regular side, that is important. If it goes on the PRN side, then you can decide that, okay, if it is not required, I'm not going to give it, because those are only as needed ones. But if it is on the regular side, then you have to give it, unless there is something else that is wrong with that medication.
Okay.
Has everyone understood that one?
Yeah.
So I'm going to say that, okay, you are due for this medication and I can see that it is a valid prescription. Yeah, so I will be giving you this medicine. So I'm going to put the dot again over there, and I will, from my drug trolley, I'm going to be taking out a codeine phosphate. So I take out a codeine phosphate and I will be looking that it is a 30 milligram tablet. Yeah, and the dose says that it has to be given 30 milligram and it is within expiry. So I can give this medication. So you are going to take another of that medication dispensing little pot. You are going to put over there and you are going to open it and take out one tablet from there. And you are going to close this and put it near to that thing. So you know that that is the codeine phosphate that you are giving. Okay, so that takes us to the next medication.
So each
yeah,
medication should be in a different pot.
each medication should be in a different pot so that we know that which medication we are giving to the patient.
Okay.
And we can sign for the correct medication when we are giving it.
Okay.
Okay, Nivya, can you read me the next one? Nivya, can you hear me?
She's having some issues with the mic, ma'am.
Okay.
Can she? Yeah, she is checking my room.
Yeah, you can share.
Hello.
Yes,
Good
Nivya.
evening, ma'am.
Yeah. Go ahead and read the next one.
Okay, the drug is metformin and date is today. And the dose is 500 mg. Frequency is twice a day. Route is per orally and duration is ongoing. The time is written as 12 and 18. And the time is now the time is 18 and there is no doctor's name on it, so I'm not giving this medication.
There is a doctor's name if you look at the next page. So it's the page just gone down. So just look at the next page.
Okay, ma'am. Okay.
Yeah.
Okay, ma'am. And I have checked that I will check that the patient is having have taken any food during this time. And it is a the metformin is it's a drug for diabetes, and if the patient is having any diabetic issues, means I will deliver this medication.
So the chart which you are reading at the moment, are you going to give this medication or are you not going to give this medicine?
I will check for the prior due dose,
Mm-hmm.
and there is there is a due dose of 12.
Mm-hmm.
That means I need to give for twice a day.
Yeah.
So I will be delivering the medication.
Does everyone agree with that one? Anyone wants to add anything on this?
Check the blood sugar and make sure that your patient had any food or they are going to have any food.
Yeah, the blood sugars are okay. Patient has had food, so that is not a problem. He had some tea and all that.
Then ask about any allergies to this medication.
Patient is not allergic to it. It's a regular medication, so he's been taking it for a long time.
Ma'am, this is metformin,
Hmm.
and it is ongoing medication. Actually, today's the prior dose is 12 the time they are given, and we are giving it 18. It is
Mm-hmm.
only twice a day medication, so that means it's 12 hourly we have to give.
Who told me this? Roshni? Did you say that?
Yes, ma'am.
Well done, Roshni, because that is something that you have to look for, that if the time interval over here is not correct. Yeah, because it's a BD dose, so a BD usually is 12 hourly, and over here if you see it is only 6 hours in between. So the frequency which they have written, the timing which they have written is not correct. So what code are you going to give it over there?
6.
So you will give a code of 6 that it is a wrongly prescribed or incorrectly written. Yeah, and straight away you are going to write at the
Bottom.
at the back as well, the drug not administered. So now that brings us, so well done for figuring this out. Now that brings us to the last page where you can see it is the intravenous fluid therapy. Now for intravenous, you will not require to administer any intravenous medication or any intramuscular medication for the exam purpose. It is only oral medication that you will be giving. So over here, but it is important that you read it out, even the intravenous thing. So you are just going to read it, that I can see that you are on normal saline, which was started at in the morning at 10:30 and it is due to finish in 8 hours. And I can see the doctor's signature and the batch number is written, and you can match that the batch number is same, but it is going to run out in another half an hour or so. So someone will come and disconnect it. So you are not going to do anything, but you can ask that the cannula side, that whether the patient is having any pain or not. Yeah, if and the patient will say that yeah, the cannula is, or I'm not having any pain, and it is okay. So now you have completed reading the chart. Yeah. So now what will happen is that once you have gone through the entire chart, now you have decided that it is the 3 medication that you are giving. One is the probiotic drink, the other one is paracetamol that you are going to give, and another one is codeine phosphate. So you already have got that what are the medicines that you are going to give. You have finished all the paperwork in that sense, that you have coded all of the medicine which you are not going to give, and you have also made sure that you have written them in the end. So at this stage, what we will do is that we are going to go back at the first page, and we will ask the patient that, okay, before I administer your medication, I'm going to do your second ID check. So in implementation, whenever you are giving any medicine to the patient, you will be asking for the second ID check as well. Yeah, so in that one, you will ask the patient that, can you tell me your name and date of birth again? And you are going to say that, okay, name and date of birth is fine. So I have made sure that I'm with the right patient, and I have checked with all the medication. They are all right medication, right route, right dose. So I have completed all my hours.
and now I will be dispensing the medicine to the patient. Now, before dispensing, you will want to make sure that the patient is sitting in a comfortable upright position, and you will check that whether they have any swallowing difficulty. Patient says that no, I'm fine, I don't have any swallowing difficulty. So that is fine. So you are again going to go through that, okay, I can see this, I don't have to dispense any stat medication. Oxygen you had already stopped and you had already signed. You know that you don't have to dispense any PRN medicine. So the first medicine that you are going to be dispensing is the probiotic drink, where you had put the dot. Remember, I asked you to put the dot in front of all the medicines that you are going to be giving. So you know that this is the medicine that you have to give. So you are going to ask the patient that, okay, here's a glass of water. Can you just take a few sips? And the patient will take a few sips. Remember, over here, it is a mannequin. So the examiner is going to say that, okay, I have taken, I don't have any swallowing problem. After that, you are going to give to the patient that, okay, this is Actimal or this is your probiotic drink. So please drink it. Okay, so patient will drink it. They will say that, okay, I have done. Then you are going to confirm with the patient that have you finished it or have you swallowed it? And patient will say that, yes, I have swallowed it. So once the patient confirms that they have swallowed it, you are going to sign that prescription. You are going to sign and put the date over there at the same time. Okay. Then you will say that, okay, your next medication. So I know co-amoxiclav you are not going to be taking. I've already coded it. So the next medication is paracetamol, which, as I told you, is for your pain. So that is going to help you. So this is paracetamol. There are 2 tablets of paracetamol as you are written for 1 gram. So I have given 2 500 milligram tablets. So can you take them together or would you like to take them one by one? Patient will say that, okay, I'll take them together. So you give the medicine. Okay, here's some water. Once they say that, okay, they have taken, you are going to confirm that whether you have swallowed it and whether it has gone in. Okay, so it is very important that you confirm that they have swallowed it, because sometimes some patient, if they are not, they have these depression and suicidal thoughts and things, what they can do is that, and if they are not compliant, that they can hold the medicine over here. Yeah, and as soon as you are not looking, they will take out from their mouth and throw it, or they are going to keep on hoarding them. So you think that the patient does not have paracetamol, but if they have not been swallowing it, they keep on hoarding them and then they just overdose with that paracetamol. Okay, so it is very important that you check that they have actually swallowed it. So confirm that they have swallowed it. Once they confirm it, then you are going to sign on the paracetamol as well. Okay, so then you are going to come to the third medication, which is your codeine phosphate. So you are going to do the same thing that, okay, this is codeine phosphate 30 milligram. And I have already checked all my R's. So this is also to help you with your pain. So please take it and you give some water. Patient will take it and you are going to confirm that it is gone and you are going to sign it over there. Yeah. So then you'll say that next medication, anyway, metformin, I'm not going to be giving, and I have already coded this. So I have completed all my medication and I have completed my chart as well. Yeah. So how are you feeling? You can ask the patient. The patient will say that, yes, I'm fine. And you are going to wash your hands and you'll say that, okay, I'm just going to make sure that I put all the medicines back. And I am going to be closing and locking my drug trolley. Okay, and you are going to lock. Now you are going to be talking to the patient, say that, okay, so Raj, I have given you your painkillers and I have also given you the probiotic drink. As I had already told you that probiotic is going to help you with your gut flora. I'm not expecting any side effects from it. So it should be, you should be very well tolerating that. But if you feel anything, then please do let me know. Also with paracetamol, it is a very common drug. Sometimes it can give you a little bit of acidity or tummy upset, but hopefully it should not be that bad. With codeine, which is the next medication, you can get constipated because constipation is one of the main side effects. So please make sure that you are drinking plenty of fluids.
and you are taking a high fiber rich diet. So that is going to help you avoid constipation. But if something you are getting the side effect, please do let me know. So is there any other further questions that you have? You can ask Raj if there is any further questions. If Raj says that no, I'm fine, you can say, okay, then I have completed my drug chart. I will be leaving a call bell with you that in case if you have any problem, then you can always ring us and someone will come to help you. I have made sure that I have locked my trolley and I will keep it in the safe place. I am also going to be making sure that the patient is comfortable. I'll do my final hand hygiene and I will be leaving the patient. So that brings us to the end of the implementation. Now in the implementation, today when we started, I did not do the introductory 6 because that we take it, that introductory 6 we are going to do with every station, okay? So entry is going to still stay the same. We did the drug chart and we did the exit. Now, do you guys have any questions in how we did this in implementation, in hospital implementation? Are there any questions at all? Yes, Agu? Unmute yourself. Unmute yourself. I'm not able to hear you.
Okay.
Yeah.
Hello?
Now, yeah.
Can you hear
Yes.
me?
Yes. Yeah.
Okay. The drugs not given, like co-amoxiclav, for signing, is it only the downside we are going to sign and leave the column for signing against the co-amoxiclav plain?
You are only going to sign on the first column because that first column is the column of your today, like your date. Yeah, so you are going to sign and code against the time that you are there. So the time, as is said, that it is time says that 1800 hours medication that you are giving. So you are going to code it over there because you can't give co-amoxiclav because of the wrong frequency and the units are missing. So you are going to code it over there and you are going to sign it. Again? Again?
Hello? Hello?
Yes, Agu, say again. Yes, Agu, say again.
Okay. Both the charts where the call for not giving medication and against the amoxiclav.
Not able to hear you.
Wow.
So,
can you hear me now?
Yes.
Hello,
It is
can you hear me?
Yes, it is better now. Yeah.
Okay, thank you. I said down the chart, there is a column for not giving medications.
Yeah.
Yeah, I will sign there. Then by the side of the medication where it was prescribed, should I put another code and signature there against it?
Yeah, so I'll write it and show you.
Okay.
So it is going to be, I'm going to put a code 6 over here. Yeah, I'm going to put my sign and I'm going to put the date, which is, I'll say 3rd of August, 21. Yeah. And I'm going to come over here at the end. So I'm going to put 3rd of August 21. I'm going to put the time of 1805 was the time that I was giving this. I'm going to put co-amoxiclav. I'm going to write the no units and wrong frequency. And I'm going to put my signature and I'm going to put the date.
Okay.
Yeah.
So I will be writing all
Okay.
the
Yeah.
over here.
Thank you, ma'am.
Yeah. Okay.
Okay. Yeah.
So any other question anyone has? So now what I would want is, yeah, we are going to go through the community chart as well very quickly. That is not going to take much long. But see, this is like we have practiced our introductory 6. The same way we will have to practice saying these charts as well. That we will have to get in a habit of reading the chart, that okay, this is my drug, this is what it is used for, it is to be started today, the dose is this, the frequency is this, the route is this, duration is this, and the start date and finish date is there, doctor signature and prescription is there, it is due at the moment, it is a valid prescription, it is legible, so I will be giving you this medicine. So please go through the charts and read them again and again so that you get in a habit of saying that thing. Also, whenever you are going to say the name of the medication, get in a habit to say that what that medication is for. That, for example, the moment I say codeine phosphate, I should be saying that it is a painkiller. If I say metformin, at the same time, I should say that this is an anti-diabetic medication. So it will help you with your diabetes. Yeah. So get in a habit of saying what that medicine is so that you have got over with that. You know that you have told the patient what that medication is for. Okay. So shall we take it that everyone has understood about the implementation, about in hospital implementation and how to read the chart? Okay, so I'm just going to stop sharing this one and I'll bring up the community drug chart. Okay, just have a look at this drug chart. I'll be back in 1 minute. Yeah. So now this one, it is pretty straightforward, the community drug chart. So it won't take that long. So you will be given a scenario in the same way like you are given a scenario in any of the stations. So over here, if we see that Brenda, we know that Brenda was discharged from hospital yesterday evening, has been an inpatient in the frailty ward for the previous 3 days. Brenda had originally been referred to the hospital by her GP, Dr. Gerard, who is concerned about her presenting behavior. Brenda has been commenced treatment for constipation and a low-grade chest infection. Dr. Gerard has asked you to make an early morning visit to Brenda at home, ensuring that she is taking her medication. So you know that patient was in the hospital for some time, but now she has been discharged back home. And Dr. Gerard, who is her GP, her GP has asked you as a nurse to go and check on Brenda that whether she is okay and that she is taking her medication. Yeah, so it says that it is today and it is 8:15 in the morning. Okay. So this is the scenario. Now you will see that they have also given you the codes. They have also given you the codes over here, because if you have to, if you're not going to administer any medication, then you will need to see the codes. So the codes are same as what we have seen on the other drug chart, in the hospital drug chart. Then usually the drug chart which you get in this community is just one pager. Because remember, in the community, it is not something that you are going to be giving the medicine to the patient on a daily basis. It is patients who will be taking those medicine. They are not going to be any of those medications like which are stat or IV or IM or that kind of things. They will be a regular medication which are ongoing and which are oral medication. Sometimes they write a PRN medication, but that is going to be pretty simple and straightforward. Okay. So over here, again, we are going to start reading the chart by making sure that you have got the correct patient. So in your introductory 6, you are going to say who you are, why you are over there, and then you are going to be checking the patient's ID, your 3-way ID check. So you are going to make sure that you have the correct notes of the patient. And in the community, we had already discussed that you patient is not going to have the ID band. That is why you are going to be checking what is the patient's GP name or which GP surgery are they registered with. That will become your third way of the ID check. Yeah, so over here you are going to ask the patient that what is the name of their GP, and also you can check that what is that which GP surgery they are registered to. Then you will ask the patient about the allergies. As you can see in this chart, patient is allergic to penicillin, and you will ask that what kind of a reaction does patient have when they take penicillin. It says that patients get anaphylaxis, and that was recorded whenever the last time that patient had the anaphylactic reaction. The height and weight is also given because, again, as you know, that is important that you have the height and weight, because you need to make sure that the patient can take the full dose of paracetamol. So all of the required information is there even in the in your community drug chart. So after that, you will in the community drug chart, you are not going to have anything like stat, or you are not going to have any oxygen or IV. All those things will not be over there. Okay, so straight away you will start reading the chart. You are going to say that first medication over here is which was written yesterday is Senacot. Now, what is Senacot? What is Senacot? Hmm?
Laxative.
Yes.
Laxative.
Yeah, Senacot is a laxative. So you will tell that, okay, Brenda, your first medication is Senacot. It is a laxative, so it is going to help you with the constipation. So you are written for 2 tablets of 7.5 milligrams to be given at night. So it is a medication that you will need to take at night at 2200 hours, and it is to be continued for 7 days, and you will need to take it with full glass of water. I can see that the prescriber signature is there, and it is I can read this prescription and it is correct and it's a valid prescription, but it is not due at the moment. Yeah, it is due at 2200 hours, so I will not be giving this medicine. Yeah, everyone understood that?
Yeah.
Now, Agu, do you want to read the next medication?
Yes, ma'am.
Yeah, okay, go ahead.
Okay. The date was yesterday. The drug name was amoxiclav. Dose 625 milligram. Time 8 o'clock, 14 o'clock, 1400 and 2200. Frequency TDS. End date in 7 days. And complete course and doctor's name and the signature there. But the patient is allergic to penicillin, so I will not give the antibiotics, and I will explain to the patient that I will discuss with the doctor to prescribe another form of antibiotics, because I will not give this one due to allergy.
Mm-hmm.
Yeah, but the dosage and the frequency are correct. The prescription is legible, but patient is allergic to it, so I'm not giving it. And I will advise the patient not to take it.
Okay, and what are you going to record?
I'm going to record code 2
Mm-hmm.
due to clinical reasons.
Okay.
Right, and the sign date.
And where else are you going to record it?
Okay. Not given, and I will record the reason why I did not give it due to allergy.
Yeah, so you can see in the end of the drug chart, there is this section, drug not administered. So at the same time, when you are going to code it over there, you are also going to write over here as well that you did not give this medicine and the reasons and everything, as we did for the other chart.
Okay.
Okay, well done. So
Okay.
who is going to read the next one? Jinsi, do you want to read the
I
next
can
one?
read.
Okay, whoever is reading, please continue.
Yes.
Okay. The date is was yesterday, and the drug name is atorvastatin. Dose is 40 milligram.
Yeah.
The time is 2200. Frequency daily. End date ongoing. And special instruction: avoid grapefruit. And the doctor's name and date is there. The drug atorvastatin is the drug for cholesterol, to reduce cholesterol level.
Yeah.
And the time is not due because it's 1800 and the time is 22. And again, the dosage is too high. Am I correct?
Yes, it is. You're right. So well done for that one. So you have read it is otherwise a valid prescription, but it is not due at the moment, and you are not going to give this medicine. You don't need to give it because it's not due.
Okay. So I'm going to write the date and the drug atorvastatin, the time 1800, and the reason not given is
No, that is not right. You are not going to write anything for the medicine which is not due.
okay.
Remember, it is not that you are not giving it. It is just that it is not due. You can't give it.
Okay.
So it is not that you are going to note drug not administered. And guys, this is for all of you, that you are going to note that drug, you are only going to code those things which are due, but you are not giving them for certain reason.
Okay, to bring you back, this co-amoxiclav was not due as well because they wrote 8, 1400 and 2200, and my time is 1800. It's
Your
not
time is
due.
8
And
o'clock.
secondly is
No, your time is 8 o'clock. See, it says 8 morning. So that was due.
Yeah.
Yeah, that's why I didn't say anything, because that was due at 8. So atorvastatin is not due. So that is why we are not going to write anything. We would have written, if we would have noted that it is patient is allergic to some medicine, and even if it is not due, we would have signed or we would have coded that one, because we don't want anyone else to by mistake give it. Yeah, say for example, patient was allergic to atorvastatin. At that time, we would have coded this, that this is patient is allergic to this medicine, so it should not be given. That time you can code and write it, because you don't want someone else to come and give this medicine, and they might not realize that patient is allergic or not. That by you don't want them to make a mistake. Yeah, but otherwise, if the medicine is otherwise correct, it is valid prescription. But if it is not due, then you are just going to leave that section, that okay, it is not due, I'm not going to do anything over there, and you are going to move ahead. Yeah, remember, someone is going to come at 2200 hours and sign it over there, because then they will give it. Everyone understood this thing?
Yes, ma'am.
Okay.
Yes, ma'am.
So, Jinsi, you read the next one. Paracetamol.
Yes, ma'am. Okay, Brenda, your next medicine is a paracetamol. It has been started yesterday. The dose of the medicine is 500 mg, 2 tablets. The due time is 8 hours, 12 hours, 18 hours, and 22 hours. And the frequency is 4 times a day. It has to be taken for 7 days, and it has to be taken if needed, and the prescriber's name and date is there. So I've completed all my hours, and it is a valid prescription. So before for administering, I'm asking you a question. Are you experiencing any pain right now?
No.
Okay, so do you think that you need this medication to manage your pain?
No, I'm fine actually. I don't have any pain.
Okay, so it has to be written that if required, you can take this medication. So as you have no pain right now, I'm not going to administer this medication to you. So I'm coded this as
No, you're not going to code it. Why would
sorry,
you code it? See,
it is
patient did
due.
not require it. That is why you did not give it.
Okay, so
it is not. Yeah, that is what you need to
not
remember, guys. That if the code you give to those things which you had to give but you could not give.
okay.
Yeah, the things
Okay.
which is like at your discretion, that whether if required you give it. So it is not that you had to give it. It was only if it was required you will give it, and you have established that it is not required, that's why you didn't give it. So it is fine that you are going to leave that space, that whenever patient will require it, then they are going to give it and sign it.
Okay.
Yeah.
Okay.
Okay, so Anju, do you want to read the last one, bisoprolol?
Yes, ma'am, I'll read it.
Yeah.
Okay, so the next medication is bisoprolol, and the date is yesterday, and the dose is 2.5 mg. The time is 8 hours, and the frequency is once a day, and the medication is ongoing one, and the prescriber's name and date is mentioned. So it's a valid prescription. So before going to take, I want to know your blood pressure.
Yeah, blood pressure is 130/80.
Okay, so I will give you this medication.
Okay, that's good. So well done for asking the blood pressure before you give any of the antihypertensive medicine. So that is very important. Yeah. So you see that in the whole of the drug chart, it was only the bisoprolol that you had to give. You could not give the Senocot because it was not due. Coamoxiclov you could not give because patient is allergic. Atorvastatin is also not due. Paracetamol patient did not require. So you will only give the bisoprolol. Yeah. So the community drug chart is slightly easier than the hospital one, although the hospital one just looks like that it is difficult because there are different sections, but otherwise it is almost the same thing. How you are going to tackle it is going to still stay the same. Same way you will have to say all the things, same way you will have to decide, same way you will have to code them, and you will need to write at the end. So that completes our implementations section. Now, is there anything, any queries that anyone has?
Ma'am, in a hospital setting, we are having drug trolleys. So what will we do when it is a community setting? Should we ask the medication from them? Or what should we do?
Yeah, usually there will be a box. I'll show you. So this is a type of a box that you will have. Yeah, a medication box when you are in the community. So all of the medication that you will require are going to be in the box.
So you are going to say the same thing, that you are going to make sure that you clean your hand and that you open the box, and then you are going to take out whatever medication that you require in the same manner as you did it in the drug chart. In hospital, in the drug trolley. Yeah. So normally these are the type of bottles which you will be getting in the hospital. Oh, sorry, in the exam and in the hospital as well. These are the type of bottles. These are the bottles which are child safety bottles. Now, what it means by child safety is that if you are going to open them, you can't open them like that. Yeah. So in order to open them, you will have to press them down and then twist it. Press and twist. Only then you will be able to open it. Okay, so when you are going to go in the exam, and when you obviously you will practice before that, but make sure that you are not just struggling to open it just like that. It won't open. Okay, any other question?
Yes, ma'am.
Yeah.
About the paracetamol in community setting, it wasn't given, but in the hospital, you told us about the regular medication that we should give, and try and talk to patients while we are giving. But paracetamol here is also like a regular medication for the patient at home.
It is not a regular
So,
medication.
okay.
See in the special instruction, what does it say? In the special instruction, it is telling you as needed.
Okay.
So
Sorry,
this
ma'am.
becomes a PRN medication for the patient because it is only as needed. It is not an ongoing medication.
Yes.
So it is not a regular, it becomes a PRN medicine.
Yes, ma'am.
Okay, any other question? Okay, fine then. So tomorrow, I think what are we doing? Tomorrow, are we doing fluid balance?
Evaluation?
No, tomorrow we are doing evaluation and we will be doing fluid balance. I think these are the two things that we are doing.
Okay.
Yeah. So I will share a few of the fluid balance scenarios with you guys. Have a go through them. I'm sure that all of you would have learned how to do a fluid balance. I'll share an empty, a blank fluid balance sheet as well, so that you can look at how that sheet looks like, what all other things, sections that you have to fill, and that you are able to get a hang of it. Yeah, and I'm also going to share a blank evaluation template as well, so that you can have a look at what the evaluation looks like. Okay, so I think that tomorrow that will bring us the end of APIE, plus we are going to do one skill, which is a fluid balance skill. And then day after we are doing the VIP, NG tube and the Braden score. Okay, so if there is no further question, then shall we call it a day?
Yeah. Thank you, ma'am. God bless you.
Okay. So well done, everyone. So I think it was a good session, and you did get a little bit of a practice to read the charts as well. And I think that if you practice a little bit more, you will be able to do them. That is not a problem. The drug knowledge is important. Majority of you today were able to pick out the problems which were there in the charts. So I'm really pleased with that one. So, but just make sure that you go through all the medicines which I have already shared with you guys, so that you can memorize them and learn those medicines. Okay. So have a nice day, rest of the day. So all the people in quarantine, are you guys doing all right? You must have got your day 2 results and things.
Yeah.
So the day 2 result, have they come back as all negative?
Yes,
Yes,
ma'am.
negative, yeah.
Okay, good. So carry on and practice the charts, practice the care planning and all that. Write another care, problem for Brenda
and for Henry. So you can plan or write some other problem for him as well. And all the people who have not written as yet, please do write and share it with me. Okay.
Thank you.
Okay.
Okay, thank
Take
you,
care,
ma'am.
everyone. Bye bye.